I make a living doing hip and knee replacement surgery. 4 years ago, I had my own knee replaced. I'm going to tell you 5 things I learned that I really didn't know until I was a patient. I'm Dr. Randall Schultz, a patient, a surgeon, and your guide. I'm a board-certified orthopedic surgeon with more than 25 years of experience specializing in hip and knee replacement. Along the way, I've had the privilege of training residents and fellows and caring for thousands of patients. I've also been on the other side of the table. I've had a knee replacement myself.
This is the Surgeon Unmasked.
The first thing I would say, and I did pretty good with this part, is get ready for it. I spent 6 months getting ready for my knee replacement surgery. I lost 35 pounds. I worked out every day. I got on a stationary bike all the time, which I highly recommend. And I worked really hard to get my quadricep muscle, my thigh muscle, really strong because surgery is going to knock it down quite a bit. There are some things you can't control when you have surgery. There's risks you take, but that's one thing you can really do to lower your risks, improve your recovery. And I would highly recommend you take advantage of the fact that surgery is elective. You can choose when you do it. Do it at the time when you're in the best possible shape for it. The recovery is challenging. It's difficult, arguably one of the hardest ones in all of medicine, not just orthopedic surgery. But the better shape you're in for it, the easier it'll be for you. I tell people it's almost like an athletic event. You've got to be really pretty nimble, pretty fit to be able to handle the rigors of rehab, the risks of falling, all these things, but do your very, very best. The other part is normally we have you modify your activity when you've got a bad knee. If you're having surgery, it doesn't really matter anymore. Yes, I don't want you to be miserable and uncomfortable, but you can work out pretty hard, even if it bothers that knee a little bit, because you need to get ready. The second thing that really surprised me was how easy it would be to fall. I was pretty young when I did this, but I can see how it'd be very, very easy to fall. It's hard to get around on a walker when you're on pain medications, you just had anesthesia, your blood pressure can fluctuate or run a little bit low, oftentimes, especially with spinal anesthesia. You're oftentimes carrying around a pain pump. It's quite difficult. So there are some things you can do to mitigate that risk. Make sure you get the home really ready. Cords and cables running across the floor are a common hazard. Area rugs that have corners that can lift up. Get them out of the house or get them take down, whatever it takes, but try to lower your risk. Another big one is dogs or animals. I love dogs, but if you have a real rambunctious dog, you may want to think about kenneling them or putting them up with a friend for a couple of weeks. Another thing you can do, and this more applies to men, but I got a urinal for the bedside. Late night bathroom trips are when the majority of falls occur. So for females, you can look at getting a bedside commode, but most importantly, if you do have to get up and go to the bathroom in the middle of the night, particularly your first few nights, make sure you have some help. It's a really hazardous time otherwise. Along with the falls, what kind of surprised me was how uncoordinated I was. We don't really think about this very much, but our bodies do pretty well when we're slowly adapting to changes in our joints and our stiffness and our flexibility and our strength. But when you have a brand new joint put in overnight, literally, it changes subtly your leg length, the angle of your leg, the way you walk, your gait pattern. So oftentimes people will have some hip and back discomfort and just trying to get used to that new way of walking. But I found myself probably for at least 2 or 3 months being quite uncoordinated. And some of it may have something to do with what we call proprioception, that because you don't have the normal feedback and ability to feel the joint and space and time and where it is and how much pressure's on it, that you lose a little bit of your coordination. I can remember walking around the neighborhood and I'd oftentimes catch my toe on a curb, which is something I wouldn't normally do. Now, that does get better with time, and now I'm quite comfortable with it, and maybe I'm just an uncoordinated person, but be aware of that. So keep your walking pretty simple in the early days. Keep it on pretty flat, even surfaces. Slopes or grades can really put a lot of extra stress on your knee, and those kind of need to be eased into. So keep your walking very flat, very even. The last thing I'd say about falls is, this is back to the home thing, but if you want to make sure you have good lighting, and you don't want to have to get up in the middle of the night and go walk across the room and flip a light switch. So have some kind of system in place where you can immediately get good lighting and see what you need to see before you get up in the middle of the night. So we have to talk about pain. Unfortunately, knee replacement surgery is pretty darn painful. I went into it expecting it to be awful. I didn't think I would handle it very well. Turns out I did all right, but it's hard. And the majority of people are going to need some kind of opiate pain medication, unfortunately. Opiates make you feel bad. They make you feel loopy. They cause constipation. They interfere with sleep. They can cause dependency. There's a whole host of reasons that we'd prefer other ways, but generally, unfortunately, we still need a little bit of them. By far, the most effective pain medication for joint replacement surgery are nonsteroidal anti-inflammatories. Unfortunately, some people can't take them. They're on a blood thinner or have kidney problems, stomach problems, allergies, etc. And you can also use Tylenol. Our sort of goal, and the way I did it, is to try to maximize the anti-inflammatories in Tylenol. So you need as little of the opiate as possible. And then hopefully you can get off the opiates pretty soon. Don't make the mistake I did. I thought I was Superman, and day 3 said, I don't need these anymore. Stop taking them. And I had a terrible night. I wasn't quite ready to completely get off of them. And you don't want to get behind pain. It's really difficult to catch back up once you get behind it. Eventually, by day 6, I was able to get off the pain medications, but I did it the right way. You want to very gradually increase the distance and time between your dosing. So if you were taking them every 6 hours and go to every 8, then 12, and etc. But be careful about very abruptly stopping them. It can get you in trouble. The last thing that's still quite effective is good old ice. And I don't think you need to spend a lot of money here. Just plain old ice packs or gel packs that you wrap around with an ACE wrap can work quite well. You got to be careful. You don't leave cold things on directly next to skin for too long. It can cause the skin to burn, and I've seen that. They do make these ice circulating devices called cryotherapy. Generally, it's a cuff with a tubing that attaches to a cooler that constantly circulates cold water through there. They're nice. They're kind of a convenience thing. Most of the time, insurance won't cover it. But if you wanted to make a purchase or borrow a friend's, if you do borrow a friend's, I'd advise to get a new cuff, get something that's clean. We don't want infections. It is convenient for the patient. It's not so convenient for the care provider. They require constantly refilling with ice or cold or frozen water bottles. So there's a little bit of a hassle factor that goes into them, but they can be helpful. And you can find them on Amazon or medical supply stores, for example. And maybe one of the biggest surprises to me, and didn't really realize until I was a patient, is how fatigued I was from the operation. It was one thing to be recovered enough to get around, and I was fortunate that I didn't have a lot of sleeping problems. Most people do, and they will often go on for 6 to 8 weeks after surgery. But I was very tired with very limited activity. I decided to try to go back to work around 3 weeks, and I would come in for half a day and see patients, do surgery for a half a day, but I was exhausted by that time. I had to go home and take a nap. I haven't taken a nap since I was in college. I haven't taken one since. But you undergo a tremendous amount of depletion of systemic resources is the best way I could say it. The surgery takes a lot out of you. It's a massive healing response, a massive inflammatory response. You're a little bit anemic from the surgery. The pain medicines also probably don't help with this, but you're going to be tired. So for people trying to get back to work, usually we'll let you do sedentary work around 2 or 3 weeks, but be careful. You're probably not going to be able to handle a full day. You're going to get very fatigued very early. I didn't really feel like I had my full strength to go a full day till I was like 8 weeks after surgery. And the final thing that really surprised me the most, and this has helped me in counseling my own patients, is it takes a long time to see the finished product. Everyone wants to know, when am I recovered? Well, what do you consider recovered? Most people, I would say, by 6 to 8 weeks feel better than they did before surgery if the right indications were there for the surgery and everything's going well. You're probably not going to see the finished product for at least a year. I think mine got better for 2 years, maybe even 2.5 years before it sort of leveled off. So don't be discouraged if you're 3 or 4 months after surgery and it's still not how you would hope it would be. It's still probably going to get a lot better than that. It just takes our body a long time to accommodate a new part. So this is my first episode on this channel. I hate to ask for this, but if you wouldn't mind, like or subscribe. That'll tell me you want me to do more of these. If you have topics you'd like to hear about, I'm open. I'm willing to say probably things other doctors don't want to say or we're not willing to say. This isn't going to be me lecturing from a podium about what a hip replacement is. Joint replacement surgery is phenomenally successful. Even in the entire world of medicine, hip and knee replacements rank very highly in terms of patient satisfaction. So I'm very honored to be able to do this profession, to help people this way, but it helps to be an informed consumer, and that's what I'm here to help you do.